one person can open that, so it will be easy for us, because today for me it is not working. I'm not able to share my screen. So in case we need to review any claims, so please, I need your help. Meanwhile, I will show you the what is our plan. I'm working on that. Whatever feedback is coming, we are making a screenshot or creating a SOP, so you guys will be getting this in a future for reference part. Okay. So in case you are getting any like a scenario in which you want to uh, that scenario you want to add into the SOP, please make a screenshot and share with me, so I will update into the SOP. So going forward, we are working that. Before I am discussing this audit feedback, this is a column where if you will see error, which kind of error is there, and what a correction done by the auditor. This is done by the US team, and which date they work done, their remark is also there, and who person is work that ID is there. So some person maybe not from our team, maybe from our team, because multiple people are working in this process. So don't worry about that. This is not related to our. We need to focus. If that scenario come to in our bucket, that time you will be learn these things. So you will be understood what I am trying to say. You are getting my point. Don't
Yes.
focus about this is a Chandan error, this is a other errors. Now we are focused on, in case in future this kind of report is coming to you, you will be understood this scenario, right? Okay, so let's discuss that. If someone open that, it will be easy, but first we discuss the error, then we are checking each and every document, so it will be more appropriate to understand. Okay, see in this error message is mentioning missing modifier or too many DX. So when we are reading this claim, so we found that one definite diagnosis and multiple symptoms are there, but we are not removing the symptoms, and we coded both ICD. For example, left knee pain is given and left knee arthritis is given. So knee pain is a symptom of that diagnosis. So that time we should not report the symptom along with a definite diagnosis or underlying condition. I am just giving example. Scenario may be different. You are getting my point. Which kind of ICD or which kind of diagnosis will not code it? If you are understood that is a part of that diagnosis, that a part of that condition, it should not report separately. If symptom is there but that is not part of that underlying condition or definite condition, we can code separately. You understood? This point is clear. Okay, we will open this
Yes.
chart and discuss that missing modifier. So whenever you are coding multiple CPT code, for example, 20605 and ENM code along with other CPT code, any two procedure or multiple procedure, you should check the NCCI edit or CCI edits. In a Codify, if someone not aware of that, I will show that how to check that. So no worry. So whenever you have a more than 2 CPT, more than 1 or 2 CPT, that time you need to check the NCCI edit. If NCCI edit is showing and that column 2 we append a 59 modifier, or there are some Medicare or Medicaid guidelines, XU modifier or this kind of XU or 59 modifier we are appending. So it depends upon the guideline, but in general 59 we are appending. Okay, I will explain when we are seeing the scenario. So see here in this error, what is they mention that missing modifier or diagnosis. So we'll open this chart and I will show you. For this, this is a ENM related update, down coded. Down coded means that ENM label coded by coders 99202, 99203. But as per document, it should be 99204. 99204 is saying for moderate CPT level of ENM. So we'll review this, and why they are taking this, because they mentioned that decision for surgery was made. So I will show you guys in a MDM table, if decision for surgery is performed without risk discussion. so that will be going into the moderate level. If decision for surgery is done with risk discussion, so that will be going into the 5. But we also need to check table A, table B, table C. If those are doing the ENM codes, they are aware what is the table A, table B or table C. If those people are surgery part, I believe that you also know that. If you are not aware, no worry, I will explain. Okay, it is this 2 point is clear for you guys. We'll review the report also, because if it will be a work for me now, I will show you these all things, but I request one person who can share his screen or her screen, then we'll be see the chart. Meanwhile, I wanted to explain where you will be see the feedback and which kind of feedbacks are there. See what I measures in that NCCI audit related, because 59 modifier is missed. See in this incorrect diagnosis, pointless pointer, sorry, incorrect diagnosis, pointers, jz not needed, missing modifier. So we'll see this report why coder are added a modifier jz and client is told that no need to append, and diagnosis is incorrect. We need to check also add and delete appropriate modifier, fixed pointers, so we need to check this also. They mention there here use arthritis for the OV and X-ray and pain for the injection, modifier 59N. Okay, so they mention there use osteoarthritis or arthritis related condition. We'll see the report, that time it will be more clear, so no worry about that. Next error is here missing modifier, diagnosis here extra modifier, DX pointers, missing modifier, incorrect modifier, I think change to left or right modifier for the Etna patient, so we need to check this. So I think all are related to modifier, some of related to units also, so we need to check that units. Okay, right. So who is a login in mail mod or crystal also, I think, but few claims are related to ENM or clinical documents. So anyone who want to open this, so we can go through there. For today, for me it is not working, otherwise I will show you guys. Who want to share his or screen? Could you please let me know? Shall I stop my screen? Meanwhile, do you have any question? Please do not hesitate and let me know, so I will explain those also. Jyoti, Kalyan, Tejas. First of all, you will be share your screen and open this Excel sheet. Make a filter on G column and just making a I will guide you how to.
Yeah, I'm not on system.
Hmm? What?
I'm not on system.
Okay. Anyone please open your today that software is not working for me. I got team, please, if you have any idea, again I am sharing my screen and let me know so I can able to connect. I don't know, same password is working for others, but when I'm trying to log in, it's showing invalid. Why? Let me show you guys so you'll understood. I think Arun is send me that detail. Please give me a moment. I think it is meanwhile, if someone log in, please log in, so it will be I know this is for today it will be hectic, but if we are understood how the client want, how we can code, how client want to proceed the reports, or how we are providing ICD CPT, so it will be easy. This is the first time client shared the feedback and they are sharing their feedback as per report. like one comment they given, two comment given. This is the first time they shared it together, so it will be good for us. At least we are getting from the external side, and we have also planned to provide a support from the internal. So I'm working on that only, but today, for me login is not working. That's why I'm not able to audit the chart. I think it is open. So you guys are following here, login with username, right? Hello.
Just give me 2 minutes. I will do that.
Okay, fine. Here, login with username. Shall I click here?
Uh,
Yes.
Kamal, can I share my screen? Software is open with me.
Yes. Please share. No issue. I stopped my screen. You will share. Jyoti is sharing, right?
Yes.
Jyoti, first of all, you will open that Excel sheet which is shared by Arun.
Open only.
Okay. So
Kamal.
you will share that which claims. Make a filter into G. Click onto the J and just make a filter, and F also. F also. Go into the F first. F, not there. F, column F. Yeah. Go.
1 minute.
Mm. And you will remove the blanks. Yeah, you will remove the blanks, and okay, just okay. So now you are able to see that this much. Just increase the size of column. Yeah, so we can easily see what is the errors. First, you will be, yes, and meanwhile you can hide the date or something. We need to check the remarks, correction made, and this both column just hide. Okay, understood, and make it in the proper so we can easily understand. Open this. Okay, missing modifier, too many diagnosis. Okay, so that's why team, what I told, that you will also one column for diagnosis, another column for the CPT, another column for the modifier. So see, you will see here, like they are made the correction in this report, but what coder coded, that information is not there, because maybe client is removed that diagnosis. See here, only one diagnosis is given. And one update I want to let you know, that 99204, that is a follow-up visit. Follow-up means that paying as a zero. So we can't append 25 modifier. 25 modifier is a saying if ENM service perform along with any procedure perform. Procedure means that any surgery, any other like separate reportable services is performed. That time we are appending a. Yes, this is, I think, follow-up visit. Yes, Jyoti, open that medical record so we will understood. Okay. Jyoti, you are opening the medical record, right? You are trying to find the claim ID.
Well, that bill ID I'm searching to
Okay.
open that report.
Yeah, understood. Just
Oh,
Control F is not working here.
38. Oh, I think TP87
Right.
server S6M5. Cross 22326.
Right.
Up to 29 only it is there. 11.7.
Okay. In a Excel
I
sheet,
think
which
it's
date mentioned there? I think they mentioned date of service.
Charles Romano. Sorry, this is a different one.
Yes, yes, please.
Wait. I will close my sheet.
ठीक लेकिन काय मला फाइन फाइन नहीं जाती फाइन और 5,000 रुपये का फाइन दे मेरे पास 5,000 रुपये नहीं था बेटी मेरे पास 5,000 रुपये नहीं
See, 223 is our date of service.
Okay.
Recheck Medicare pending days. But I'm not getting this bill ID. We need 8S6M5.
Okay, as per date, which medical record is available? Could you please check that? Maybe.
See, 29 here.
29 date of service, but our date is
And 11.
223.
And one more thing, it is still not coded. See,
Okay.
then how they marked error, and here it's showing bill. I opened correct only. See, Charles R. Mano.
So how is it possible? Like document is not there, but here showing 29. Date of service is showing 29.
But
You open, I think,
wait.
different. Please be careful and open proper.
See,
Here DOS is showing there like 29. Yeah.
oh, sorry, I think mistakenly.
Yes, no issue.
So this.
Yes. So in this Excel sheet, they mention that error related to diagnosis and modifier. So see here, as please open that Excel sheet once again. Yeah.
Missing modifier and too many diagnoses.
Okay. So first they given that modifier, like 59 modifier they added, and diagnosis they removed. So please open that. So let's see how many CPT they added.
Here, this one is secretary need to write. This is our budget law.
So Jyoti, you have already opened the Codify now. Just open the Codify. So I think people are not aware of the how to check the NCC edit. So we'll also explain. See here. Yeah. First you will be open the Codify. So I will explain that how to check the NCC edit. So you can like understood we need to append a modifier or not.
Yeah. Today only Arun shared that way. This.
Okay. So just as no, not there. I think you Codify is showing now. Just click on Codify. In a left side you will see the Codify. Click on there. Yeah. Click. Yes.
Okay.
So you will again go to the Codify. There is a Codify option is coming. Click on there. In a top now.
This one.
Codify top. APC Codify is showing the left side top. Like left.
Okay. My Codify.
No, not there.
Then
your right side, go right side, Codify by APC mention, no? Just click there. Click there.
okay, same it page
Okay,
reflecting.
scroll down.
Uh,
Yes. It will come, otherwise I will let you know the another option.
This one NCCI, right?
Yes, click there. So see, just click on plus. I think then it will plus icon.
Okay.
Yes, yeah. Scroll down. You will add the CPT code. So see in that claim how many CPT are added. Sir, please add those. 20605
Okay, you tell me, I will add.
and
Then
770. I think that code was good. Just go once again. In back slide, now go once again.
yeah.
Where like a CPT code is there in a crystal, I think.
Okay, here you are asking.
Yes. How many CPT coded now? That we need to add a
77002.
Yes.
J3.
See, in this report there is no CC edit is reflect, right? No
Yes.
no CC edit is reflecting, but client is saying we need to append a 59 modifier with a 770. So you will check there. This is a proper claim, I think so.
Actually, I think there is some mistake because they have also not added 59 modifier. They have added RT modifier with 77002.
But they are given a
And
feedback. They given a feedback. In a like Jyoti, go
But
back to the.
after the build also there is no 59 modifier. If they would have required 59 modifier after build
hello.
status, they would have added that.
Yeah, I understood. I understand your
Hello.
concern.
Hi, Kamal.
Yes. Yes, Kalyan told.
Sorry to interrupt you. The 59 modifier we can't give to 77002 as it is an add-on code for major CPTs like injections.
Yeah, we understood that. I'm saying no NCCI edit is showing there. So why we are appending the 770 with
It is add-on code. So for add-on codes, there is no modifiers we need to add like 59 or 50s, whatever it may be. We
right.
can't add for
Yeah, that point I understood. So in these things we need to make a reverter. So Jyoti, just I think Chandan Chaudhary ID we are not using that. It is not from our side.
our side only, I think.
Our side. Just after the Chandan Chaudhary, now you will mention that revertals. Just make above the like headers revertals. Okay. So in these claims we can reply that as per review there is no NCC edit found, and as like client told 77002 is not required to add a 759 modifier to remove the bundling issue.
And can you take once the insurance, please?
But
Insurance.
Insurance is okay, but see there is no conflict, so why? And also Jyoti, check that on the same day any other claim is there and which CPT is built if any claim is created on same day. Maybe say they created separate claim. Medicare, I think.
No. Insurance is Medicare. No, 29. Wait.
Actually, I think instead of RT modifier, they have given 59 modifier because with 77002, auto coded RT modifier is not there, and maybe coder missed that RT modifier.
RT, they given RTLT, that is a different. RTLT is a informative. If you are appending, that is a good. But 59 is a like pricing modifier. So we need to clarify with
No,
the
no. Actually, my point is, it is not auto coded. RT modifier is not auto coded usually.
okay.
So that's why the client have given RT modifier, but in typing in the Excel, they missed. They mentioned instead of RT modifier 59 modifier.
I agree with you, but why we are assuming? We just clarify with them. No? If they
Yes,
want
yes,
they
yes.
want a 59, then what we can say? It's better we can clarify with them, right? Because they given
Right, right.
feedback. They are not giving a work. They
Time
given,
आगवायचं Blinkit.
so this is a feedback. So it's a better we are asking to them for like clarification. So Jyoti, you can write simply as per review the medical record. This CPT is given. So there is no conflict with the NCCI edit already you are mentioning and found. So and there is no required to append 59 modifier along with this. So let's see. Let's move to the like extra diagnosis. Which extra diagnosis they coded? So others, you are getting my point now. What we are trying to explain here, because if fluoroscopic guidance, sometimes I think some code is saying like with ultrasound, without ultrasound. If that time is okay, but as Kalyan told, it is a kind of add-on code. We can't append the 59 modifier. Also, we do not have a like NCC edit, so we can't code this. Okay. If client want their guideline, it will be. So we will follow, but it after the confirmation only we are following, right? Before we can't follow. So it better we are clarification. We are asking a clarification on this. So everyone clear on this point? Still any question, any doubt, any you have?
No.
Okay. So as I know that joint injection and fluoroscopy, no need to append 59 modifier. Just check the extra diagnosis. Please check the medical record. Ankle arthritis, right? And okay. Yes.
Only one ICD is given. So auto-coded other ICDs they have removed. For example, swelling and this ICD sometimes they give.
Yes.
So we need to remove.
Swelling, others like any symptoms that a part of that we need to remove, right? So don't go whatever auto coded. You can check your see. There is one definite like ICD thumb rule and guideline. If underlying condition or definite diagnosis is available and also symptom is available, so it's a better you can code the definite diagnosis until unless that symptom is not related to the primary diagnosis. If that symptom is unrelated to primary diagnosis, you can code also the symptom, but that symptom is a part of that primary diagnosis or main diagnosis, consider as a like a integral part of that diagnosis. So that's why, but in this scenario, going forward, what I told that you will also add your ICD, whatever ICD you are coding, that will be added CPT modifier. So now you are getting a feedback, so you can check your feedback here. Earlier I was given this, and now we get that. This is a client feedback, but going forward we are also providing you a feedback like every day. So if you are not adding your ICD or your CPT, auditor is a marking error. So you are not recognize your errors, because in software, if someone modify, someone delete, so you will not tracking those things. So it will better you will append your ICD, your CPT in your Excel sheet. Okay, so I believe that they removed the extra ICD. That was auto coded. Modifier related things we'll discuss, and it will be rebuttal. Jyoti, open that the down coded scenario. Why the coder not coded? So team, I think in some coders who is using this ID, please review all these claims and let me know in which claims you want to rebuttal, because client shared that. So I think we should work on that. Meanwhile, if my login is working, I am also working on this, so we can reply this. We give our responses to client. This is not a appropriate error. So could you please clarify? So I will also discuss these all things with Arun also. Okay. So in this chart is who is available, like who coded this chart? You can recognize that. See here given bilateral hand pain. Okay, scroll down in assessment, check how many order x-ray and interpretation is also given. Lab order is okay. Hand right pain, left pain, okay. And degenerative joint disorder, okay. So see, if like degenerative osteoarthritis or joint related nerve problems, especially it is a kind of joint complications, maybe sometime rheumatoid arthritis something. So this kind of conditions are mainly leading to the acute complicated or like say acute systematic illness. This kind of scenario is coming, so be careful that. And you will see here in document they mention that they are discussion. You will able to see that we are discussion for surgery. Right index finger and a small finger distal interfusor and surgery is indicated. Okay, discussed, right. So it is a kind of a small or like a interphalangeal procedure, but you will see in a table C like risk and data analyzed. Jyoti, you can open one table of like ENM table so people will understood where we are talking. Yes. So how many person who is know that how to code ENM? All are knowing the ENM coding?
Yes.
Okay, good. Scroll down, not to open the image. We need a PDF file. See here, this is a first, yeah, moderate now. You will see here, yes. But without identify the risk factor. If risk factor is given by the doctor, that time it will be moving to the high risk. You will see in a below, in a high risk table. Yeah, second line I think. Drug therapy just below. Yeah. So you will see here risk identify in a above without. So see here if we are considering this like acute illness with systematic symptom from the table A and from the risk table it is a moderate, so it's fall under 99204 as a moderate if new patient, and 99214 is a established. So please take care. Also you can check the data reviewed here, right? So table category 1 you will see there like prior external note review, order and independent historian. So out of any three category, if one category is met, that time moderate is supported. So here condition is also supporting, table B like is also supporting, table C is supporting. So all are supporting for the 99214. But I don't know coder is coded 99213Y. You will see there what a code suggested by the suggestion code. Could you please check which code suggested by software? Auto suggested. Please move to that screen.
It's a level 3,
So that's why coder
but
did not.
it is corrected.
Yeah, now it is corrected in Excel sheet they mention. So everyone understood what a scenario and how to identify or calculate the label. Just confirm yes, no, anything. Anyone want to?
Arun,
Mhm.
one more thing, from here we can check, right, who did any correction or somewhere it is there.
Okay. So earlier which
We
coder?
can check
Check that. That is good.
that.
You will see.
So I previously I searched somewhere.
Not here search icon is there, no?
This one only, right?
This one, this one.
See, we can check who edited and last who worked on this.
It is showing what?
After Chandan's,
It is showing
but what changes and don't know. But last who worked on this claim, there only that is mentioned.
Yes. And Jyoti, do one thing. Just check auto suggestion. What auto suggestion is there? Maybe coder going with the same suggestion, so we can recognize. But going forward, you will
See,
add your CPT. Yeah, they are three.
Kamal, what are auto-coded CPTs reflect in Catalyst now? These all the things it will reflect in Catalyst. So after visit note, when we review, based on that we need to make correction in this part. See, same thing will be here, but only whatever we are making correction, then it will be reflect here. So this is the auto-coded thing. See, same thing will be Catalyst.
Yes, I understand. So team, you all understood how to calculate the label for this particular chart. You take the decision how to you will visit the all those things. See, degenerative joint disease for knee joint, shoulder joint, or others. This is you when you will study now. It is a kind of some chronic condition. Sometimes it is a moderate condition. If treatment is not there, it is a systematic illness will going on. For example, it is a finger or right hand issue. If you know what is a systematic illness with a systematic problem in a table open that table, Jyoti, open that table now, so maybe coder will understood. Yeah, see here one condition for moderate. Now you will see the in a diagnosis section, in a moderate you will see the acute illness with systematic symptom. So that time we can check this also, which condition is affect our system. For example, hand is not working, one day is okay, but for chronic condition, osteoarthritis, any problem, degenerative disease, that will affect the day-to-day life, so it will be affect your body system. So that time we can understood which condition is a severe, which condition is a moderate. So I am giving as per my experiences, any condition which is a newly addressed and that is a joint related, like osteomegaly, osteoarthritis, rheumatoid arthritis, and other condition that affect the body system, and that is the newly diagnosed. It is the chances to lead to the moderate, not you will see in a low section, not it is not a self-limited, not a chronic illness. So these kind of things we need to recognize. So this way we need to check. Jyoti, please move to the another chart so we can check. I think it is not easy to review all the chart, but we are checking one by one, so you will be get the points and which kind of things we are going. So down coded, I think you are okay. See here some modifier related. They mention that JZ modifier not needed, but some coder is coded in this chart, so we need to also review. How many errors are there?
32.
32, right? Okay. Open any others here is JZ modifier related now. Just open once.
This one.
Yes.
Here a need
No, below.
with injection. Whatever injection we are coding now, we need to give JZ modifier. Here added fracture code 15J not needed. Pain code needed only for steroid injection. Okay.
today what was my plan? I will review those all errors previously and making a short note and sharing with you guys. But unfortunately, my ID is not working. That's why it is not possible to share those summary. Otherwise, one by one chart is open and review is a difficult work for you guys. I just wanted to share my findings for these claims. We found that I wanted to screenshot, so your task will be easy.
What I suggest regarding these errors, daily whatever feedback we are getting now, we will add in our folder, or he is sharing, right, Arun? So on weekend we can plan this meeting. So weekdays everyone will be busy and it's not possible to open each and every claim and review right now.
I agree with you, right? But see,
So
Here I observed so many errors are related to modifiers, which are we can check ourselves
yes,
also. If
yes,
if
yes,
I'm not wrong, so we can cover this once we can see it. Actually, each and every account no need to verify it, but we have to we came to know that what we have to actually where we need to concentrate,
right, right.
right?
But I'm not saying you will be review each and everything, but I will suggest, if for example that is that error come to you, you did this chart and you are getting, so I'll requested you all, at least your chart you will review, so your understanding will build up, because when you are getting a feedback na, so it will be easy to understand, okay, I did this mistake, so next time I will not do. So that's why you can review. And for like everybody, I will making a trends, I will review the charts. But today unfortunately my ID is not working, that's why I did not did. Otherwise going forward I try to like log in and making this kind of things, so it will be easy for you guys to, I can save your time, so you will be understood. But it is a good idea to connect on the weekends and discuss all those things. Yes, Jyoti, in this
Kamal,
chart.
in this scenario, it is a needle localization, that arthosynthesis, right? Whenever we do arthosynthesis, one drug will be injected to the space of that bone. So this injection is inclusive in this CPT. So that's why no need to give separately any JZ, zero wastage, anything modified to this.
Okay, open the report what they told.
See, yes, injection was included, but here wastage no need. It is not a separate injection like that depometrol or dexamethasone.
Okay, so it is a part of procedure, so we do not.
Yes, part of procedure.
Okay, understood. So we are making a notes of that. Team, you can also make a note if that injection is a part of the procedure and that is not used a separate drug for that time. We will
Like, Kamal, here one thing, injections regarding, one will be diagnostic purpose. So here fluorescence is a the Supars injection is for diagnostic purpose, and dexamethasone and other depometrol injection is for therapeutic use. For therapeutic use, we need to give zero wastage or no wastage.
right, right.
Sorry, that wastage JZ and JW.
Yes, yes, I agree with you. Tim, do you have any question regarding this?
And also you can check that CPT in Codify. It will guide you that if you can give JZ or
Yes,
JW
yes.
or not.
We means which CPT warrants which modifier,
Yes.
that also we can cross check.
But
So, for example,
I think in a
J77
Codify that will be showing. Just check J732.
732
Yes.
J7. Here it is. Only JW it's there, not JZ. Here drug amount discarded, not administered to any patient. So in this scenario, it will get discarded. We can use JW instead of JZ. So we can again clarify with client, then instead of JW, we can code JZ. Instead that JW we can code or not. Because whenever fluorescence or arthrosynthesis there's a diagnostic purpose only, this injection is using. So that once the vial is opened, it can't be administered to another patient.
Yes,
We need to
but
waste
in
only.
that scenario they clearly mention no modifier required. So for this kind of scenario, you will check in their statement.
Yes, we will follow that. We will not add.
Yes.
So no need to cross check with client also for this.
Yeah,
Pain
because
code needed only for steroid injection, like.
yes, they already given the clarification. So we are adding this
Yes.
all points in the SOP. So it will be okay for us. Okay. Team, do you understand
Okay.
this scenario? But don't mix this guideline for others. Like if a steroidal injection, other injection, antibiotic injection given, that time you can provide this.
We can share mode one Excel we will create, Kamal. In that, in which vaccine JZ warrants, we will add that CPTs, and in which it is not warranting, that means like SOP type we are doing, we can add in that thing, all these things.
Yes, we will update that. That is a good idea. Actually, I am working to create a SOP or guidelines. So day by day, we are updating all those things. Okay. Do you all have like a access of shared drive, right? Yes. So please open another example. So I think all are related to modifier, incorrect modifier, missing diagnosis. So we already discussed. Open one a unit related, right? Here modifier and unit errors are there, not just open one. So let's see.
This unit one, this PTOT, right? Based on the time we need to give. This PT, occupational therapy and physical therapy.
Open that someone
based on the
making,
time.
someone making a mistake. So why they making a mistake? Open one scenario. I think modifier we cover, diagnosis we cover, and that is related to unit we discuss. But in this weekend team, I know this is a very like first time we receive feedback, so I wanted each and every points we should review and discuss, and we create a like a SOP or instruction sheet. So going forward we are not making a mistake, right? If any clarification, any justification we want, we will share a rebuttal to client and they will give us a feedback, like give a proper clarification. So why I'm saying like that, because see in a first claim modifier is not required, but they recommended you need to append modifier, so that is not a appropriate coding. Why they are giving this instruction? Is there any client guideline or anything? If they will agree it is a client guideline, so we are updating into the SOP, because client do not provided any SOP, any document to us. As of now we are following the general guidelines. And one thing I want to stress out again, don't append a 25 modifier with a post-op visit. Post-op visit is a kind of follow-up visit that is not payable. If ultrasound is given, only ultrasound is a payable. ENM will not payable. So why we are appending a 25 modifier? Yeah, Jyoti, in this chart open.
Yeah.
Okay. Here total time is showing 75 minutes, and therapy visit number is 11, and also giving here therapy services description. Okay, T time is given 15 or what. Is Jyoti, you are able to see that? Where is the time? Why coder? Which word is the given incorrectly? Could you please check that? 97.
No, need to add 59 modifier like they are telling.
Okay. What they provided in feedback?
They are telling no mods for BCBS, 2 units for 97530. They are telling
No modifier.
no
for
need to
BC.
give modifier, and 2 units for N7530. So
Yes, we need to work to create a SOP. Otherwise, this challenge will not resolve.
I think this claim not open.
Please be focused and open the appropriate claim. Otherwise, all information gone like incorrect.
So I think this is corrected. Okay, for BCBS insurance, Kamal, no need to give that GP and PT modifier like occupational therapy and physical therapy. Two modifiers we give, right? GO and GP. So instead of modifiers, no need to give. We have to give 2 units with this 97530. Whenever it is coded 97112 with this, if it's come, this G series and 2 units for BCBS insurance.
So it is a general guideline, or it is a you guys are follow the same in your organization, or they given this kind of
No,
instruction?
in our organization, we always, whenever with any other therapy, if 9-7 therapy activities is the CPT comes now, we give 59 modifier with GP modifier, or it is occupational, then GO modifier. So here their client guidelines are different. BCBS, what they are telling here clearly, no mods for BCBS, 2 units for 97530. So instead of GP, only give 2 units with, I think insurance based also one we need to track.
Yes, insurance base and like location also they mention that in a top, like GP only for the Virginia and this kind of things.
And one more thing, now Arun shared one more thing in our group, like insurance based KX modifier is there. So in our project for Medicare, if there PT or OT, we are using KX modifier with GP, GO and KX. If PT and PTA also working both, when physical therapy assistant and physical therapist both working, then we need to give CQ modifier with each and every CPT.
Okay, but I think that will be client instruction. But if Arun shared it, they given the like insurance detail for which insurance we need to append the KX modifier.
Actually, for medical insurance, all this PT and OT requires KX modifier.
Yes.
But here he shared one thing. Guys, please check on this codes list based on FL Medicare guidelines and let us know on which CPT codes requires KX. Today only I received one claim in which auto-coded KX was there. L1.